Welcome to our Creating Hope podcast series by Suicide Prevention Scotland and Public Health Scotland.
I'm Jenny, the Children and Young People Delivery Lead at Suicide Prevention Scotland.
And I'm Jess, previous member of the Youth Advisory Group.
Today we're joined by Eilidh James, Quality Improvement Officer in North Ayrshire, a former teacher, and Steve Sweeney, Suicide Prevention Mental Health Coordinator in Perth and Kinross, and also Fiona Hewitt, a Development Officer in Health and Wellbeing in Renfrewshire, who too is a former teacher.
Today we'll be discussing our guest's approach to taking a whole schools approach to suicide prevention. More information on which can be found in our podcast notes, alongside practice stories of our guests' work. In part 1, we will explore practice stories, and in part 2, we will discuss barriers, impact, key ingredients and advice.
Before we start, I wanted to flag that we will be talking about suicide and that some listeners may find this distressing.
We've included helpful notes and links to sources of support, and at the end of the episode we will provide you with some telephone numbers if you're worried about yourself or for someone else.
And what we'd like to do now is to introduce our panel members, our guests for the podcast. So we'll pass over to the panel members and ask them just to introduce yourself, your role and your organisation.
Yes, that's fine. I'm Fiona White. I work for Renfrewshire Council as Health and Wellbeing Development Officer within Children's Services. My background is in teaching. I was a guidance teacher for a long time and latterly a deputy head teacher.
And Eilidh, would you like to come in next?
Yes, of course. I'm Eilidh James. I'm a Quality Improvement Officer within the Education Service at North Ayrshire Council. Similarly to Fee, we call them Principal Teachers of Pastoral Support down here in North Ayrshire. So that my route into the centre was through that.
My name's Steve Sweeney and I'm the Suicide Prevention and Mental Health Coordinator for Perth and Kinross Children and Young People. My background is social work and I ran a trauma and grief service for quite a lot of years, and I came into this post 3 years ago, really just to develop a strategy about how to tackle suicide prevention and mental health.
So I suppose just to get this kind of conversation started with everyone, this question's just out to everybody, but how was it that you guys got started with working in suicide prevention within schools?
When I was a principal teacher of pastoral support, I was very interested, and I became increasingly aware of the need to support the young people's mental health and well-being. So I was always very interested in upskilling myself in terms of managing and suicide prevention. But then I became more interested in upskilling the young people so that they're able to keep well and know what to do should they feel they're at risk or any of their friends become at risk. So that's where I started. A role came up at the centre as a principal teacher of mental health and wellbeing. I applied for that and successfully got that secondment. And I always say they've not been able to get rid of me. That was 6 years ago. And I've basically just stayed within the centre leading on all things mental health and wellbeing, and particularly have a real keen focus around suicide prevention and how we can support our establishments with the young people. So that was my route in.
I think mine was quite similar to yours, Eilidh. I was very aware of the need within schools and had supported some young people who were extremely vulnerable before I'd left school. And I think I was very aware of the lack of training that we had in schools. And the first opportunity I got coming into this post was to become an assist trainer and applied suicide intervention skills trainer. It was a 5-day residential up at Stirling University, and I have to say it was pretty life-changing. I sat there thinking, why aren't more teachers on this course? Because I was the only one from education. But as Eilidh will understand, it's very difficult to get out of school for that length of time. So I was really lucky right at the start of coming out of schools 5 years ago. I got that opportunity, and that's led to a lot of close work with our suicide prevention lead in Renfrewshire Council, and also really changing what's happening in our schools around suicide prevention. We were very aware that because my background is from schools, that we weren't accessing the right training at the time. In fact, we were weren't really accessing any training. So I think pre-pandemic, we had about 2 pupil support staff trained in assist, and now we have over 175. That's happened over the last nearly 3 years now. But it's been a huge focus to make sure that staff in schools do not feel that they are tackling this without the right training. Because as Jess said, we have a lot of young people who are extremely vulnerable in school, and we really, really need to support our staff to be able to have the right kind of conversation with them and the confidence to actually ask the question in the first place, are they thinking about suicide?
Yeah, how I came into this field of work really had a journey. I feel quite strongly about children having rights, and just by the simple fact that when you're a kid, you're really dependent on an adult to notice if you're struggling in some way. And it's not every child that gets the opportunity to have access to an adult who will ask them, what is actually going on for you? Is there something that we can do to make things better? So the voice of the child is sometimes, it's not heard at all. So that's where I'm coming from. And then when I started this job running a trauma and grief centre, very quickly learned that there's so much general adversity around for children and young people. It doesn't have to be one particular thing, but it could be about the kind of poverty, and it could be the home environment, it can be about parental mental health, and so all of these things can combine just to make life really tough for kids. And so my approach with all of this was about to start with the child and ask them, what's your best hopes for life? What's going on? And work from their perspective going forward. So I was 18 years running a trauma and grief service, which is absolutely fantastic. But unfortunately, the funding for that came to an end, and I was looking for work. And so how I came in to be very specific about suicide prevention was that I noticed this job being advertised for a young person's suicide prevention coordinator. And that to me was really appealing because, working with young people from a children's rights perspective was something that I was passionate about. So I was able to apply for this post, and 3 years ago I got it, and it's been really great. So that's a great question, Jess.
Well, thank you all very much for sharing that. It's really interesting. We've had very similar paths and then also slightly different paths as well. But what's really what I'm hearing, I suppose, is the passion for wanting to change and seeing that there's a gap and stepping into that space and trying to make the changes. The next question that we have is we're going to ask you just to tell us a bit more about some of the work that you've underdone. We do have your practice stories, but we think it's really important, I suppose, to be able to put real life to those practice stories. So, I'd like to pass over to all three of you just to share a bit about the work that you're undertaking.
Yeah, I'm happy to kick off this one. As I said, I work really closely with our suicide prevention lead, Douglas. He's been a wee bit of he'd hate me for saying this, a father figure, because he's really held my hand delivering assist and getting out there and accessing, all the contacts that he has. So we've worked really, really closely. And I think it's been a real partnership because he's gained an understanding of what we're actually facing in schools around, the level of kids who do have suicidal ideation. We take a lot of our work and we base it on the data that we have coming through our schools counselling service. So we've really got the why this work is needed. We could see that in the last quarter, from October to December, our counselling service supported 29 young people with suicidal ideation, and to have that provision within schools now is really key because it is something that would have fallen to the pastoral support staff. I always talk and assist about one of my former pupils who really has been a bit of an inspiration for me doing this work. She was suicidal or had suicidal ideation for most of the time she was at school, and I was her person that she looked to for support when she was really struggling, when she was in a bit of a crisis. And she was also sectioned into Skye House 3 times while she was at school, which was a really difficult experience. And again, I was the person that went to the multi-agency meetings to support her and give education's perspective. And I think in all of this work, relationship is really key. And we naturally build relationships in schools, and I think that's why young people do go to teaching staff to share their experiences and how they're feeling. But with her, I think what was really lovely was that despite the really difficult journey that she had going through school, she managed to get her Nat 5s and her higher later than normal, but she managed to get them and went off to university. Quite a different person, and with a level of resilience that I think that probably most young people don't have, because she'd really had to dig deep in order to be mentally well. And a real credit to her family and the relationship that we had, with the family too. But that really has been the inspiration for me. But what I hadn't considered at the time was actually the weight that was on my shoulders. And I didn't realise it until her graduation ceremony in school, where, I think the reality of her getting to the end of her school career and still being alive was quite huge. Now, that's one story. There are so many across all of our schools, because all of our schools are supporting young people around suicidal ideation. And it's not just the ones that end up being referred into our counselling service. It's those day-to-day conversations. And I think there's a real need to support staff. And it's not just about going on a course like Assist, it's supporting them around difficult conversations that they have on a day-to-day basis. So a huge focus of our work in Renfrewshire has been around supporting staff and not just having that one conversation or teaching that one lesson around suicide and being able to have a conversation about it. It's also how to have an inquisitive conversation. We've had a huge push on training for our really key staff, not just around Assist, but also around self-harm, gender-based violence, exploitation online, and most recently our approaches to cognitive behaviour therapy, which is a course that has come out of Renfrewshire. I'm currently doing my master's in CBT, and it's had a real impact on the way I do the day-to-day job, but also using those skills now to help teachers have better conversations. So that really has been a huge game changer around staff confidence. I had one of our guidance teachers say to me, a day, or the day before he'd been teaching a higher graph com class, and then the next day he became a pupil support teacher and all of a sudden was having a conversation about suicide. Nothing about him had changed. So we really need to make sure that key people have the right skills, the right training and the confidence, to have that conversation, because it's not an easy conversation to have.
I'm very, very similar to what Fee has described there around the noticing in schools about what to do. But I was very privileged to be able to come out into the centre and work at a wider local authority level. And like Fee, the suicide prevention lead, who we did call our Choose Life coordinator, was crucial to the success of the work that we have done, and been able to work with her and work with other multi-agency partners around suicide prevention. We took an approach around professional learning, putting a professional learning programme in place. Unlike Fee, I've not been lucky enough to be able to go and train as an assist trainer, but I am a Safe Talk trainer. And we believe that we can get lots more people trained in Safe Talk and giving them that confidence to be able to notice if there's any suicidal thought and then ask the question. We've had great feedback, particularly from young people. We offer, one of the pieces of work that we've been involved with is we offer this out to all of our secondary schools, and almost every year we manage to train between 15 and 25 young people from each of our secondaries in Safe Talk. Obviously they're going to leave school soon, but it provides them with the skills that to when they move on to the next stage of their lives when they're post school. We also have delivered Safe Talk to parents and carers. We've had a lot of feedback from parents and carers that they just don't know what to do, they don't know what to say, and this has been really helped with some of their confidence. We also have delivered to active schools coordinators, our counterparts who work with young people in the leisure industry. So really trying to widen that confidence out into our community for everybody who's working with young people. We've also worked really closely with youth services and collaborated with the young people. Steve, you've spoke about the children's voice, young people's voice, and I completely agree with you that that has to be central to what we're doing. So we worked with them on a communication campaign, which we called 13 Ways to Support Your Friends If They Are Struggling. So we did it 2017, 2018, when that television programme was out. So it was very pertinent at the time. We do recognise we need to refresh that, so we're at the stage of consulting with young people about how we then look at our communication campaign. But it's on the Young Scot website, you know, it is used, there's the key messages within it. The key messages won't change, it's maybe just our approach to communicating them that might change. And we've really looked at our schools to try and improve the connections with community-based supports as part of our suicide prevention work, just making sure that our staff within establishments do know that the community, the early community supports that are out there, the things that young people can do that promote positive mental health and wellbeing. And finally, one of the other pieces of work that we've been involved with from an education perspective is we've liaised very closely with our health and social care partners to develop what we call a suicide prevention pathway. This pathway has enabled targeted support to be put in place for young people who have gone to the local emergency department either following a suicide attempt or a significant episode of self-harm. With the young people's permission, we're able to share with the named person or the one good adult in the school that this has happened at the weekend, and then the school staff are aware and able to support them. Alongside that, health and social care colleagues go out and visit the home. We've produced leaflets, we provide support for parents and carers, we talk with the young person and help them to develop a safety plan and help them to identify what next. You know, because that's a very important part of suicide prevention is understanding what next, what is going to support the young people. And education staff, we've worked with them to develop some conversation guidance, you know, around what are the kind of things that you can say that are going to have an impact in that post suicide attempt phase, you know, so that because often staff members have come to me and said that they don't know what to say, they're scared they might make things more difficult for the young person. So we work together to produce this conversation guidance to support the young people. So I could talk and talk and talk because there's lots and lots going on, and you know, the feedback I'm receiving, the evaluations I receive is that this is having a positive impact. It's obviously very difficult to measure quantitatively how much of an impact the suicide prevention work has at that small local level, but certainly qualitatively, I'm hearing that staff feel better supported, that young people have got more confidence to support each other, and that the multi-agency partnerships are meaning that the message is out there. I'll hand over to you, Steve, now.
Thanks for that, Eilidh. And it's nice to hear all the work that you're doing yourself and Fee, and it's very similar to what goes on in Perth and Kinross. You know, 3 years ago, there wasn't a kind of mental health strategy really to deal with what staff in schools were telling everybody, that they were feeling overwhelmed with the concerns that they had for young people. But of course, it was all anecdotal. So my first task was to put a survey out to all schools, and got a really good high percentage return from that survey. And people were very clear in saying that yes, they have direct contact with kids expressing suicide ideation, but we asked them for the raw data on that. So we were able to say very clearly that almost 3% of kids on the school roll in Perth and Kinross had suicide ideation that staff were concerned about. And so when we drilled down deeper into that, we could identify the individual schools where there was the most concern and where there was medium and least concern, whether they were a city school or a rural school. And so we were able to target those schools in specific ways to deal directly with the actual kids that they were concerned about, because we would find that they might not have a safety plan, or they might be the kids who school found out through the community or some kind of social media platform that there had been occasion for that child to be admitted to hospital. And so that named person information service from the kind of CAMS response team wasn't happening. So again, that's something that we've developed here in Perth and Kinross, and it's initially working well. NHS is a very complicated system. We've cracked one part of it, but we need to, we've got 2 hospitals in Perth covering Tayside, different settings where young people might fetch up and they're not all speaking to each other. So it's a really important aspect of the work, how to keep kids safe from dying, making sure that it's the one safety plan that they have. It's not like a safety plan in a school and a safety plan from the CAMS team, and it has to be one. So that requires us all to really be communicating well and to remove the barriers that can exist. So looking at those systems was really, really important. From the initial survey, it was clear that staff were asking for a resource that they could access quickly and know what to do, know what the pathway was. But also what they were saying was, we're not mental health practitioners. We haven't been trained in this. We're educators. We're doing our best, but we don't really know what we're doing. Or, could someone tell us maybe? So we developed a resource which looked at risk, basically. I think that was the single thing that made a biggest impact was staff in schools were going, oh my goodness, here's someone who's experiencing suicide ideation, panic, what do I do? And so the message was about, well, remember, we've got to be mindful, be in the moment, connect with that person and stay calm, and find out what's going on. And so what we found was that in general, 70% of kids would present with what you would say is low risk kind of suicide ideation. There was things going on in their life, and for whatever reason, they were using suicide ideation language, etc., etc. But once staff realised that, so it doesn't mean that we have to call 999 and set things in motion that way, there was a much more relaxed atmosphere about a school, and so that was really helpful in the first place. I think we've been really successful in the 3 years, and so the measure of this success is I don't get as many phone calls now as I used to when I first started working. But I have to check that people aren't getting complacent. So I'm kind of physically going around to schools and saying, is everything okay? And they tell me that, over the support this past 3 years that they've had is really beginning to work. And so that's something which is to be proud of, I think, but not to ever get complacent, because there's still huge amounts of work to be done. And I think so we're moving into looking at how integrated team meetings work and how people can actually start to use more GIRFEC tools like the resilience matrix and put a lot more analysis into that tool and how it's used, so that the partners to schools can see where they've got a part to play in all of this. So yeah, like you guys, I could talk forever, but I suppose if I was to pick one area that is concerning at the moment that we're focusing on, is for those kids who are experiencing what you would call like a tier level 3 level of need. So that enhanced moving up, towards a specialist intervention is required. We're noticing that there's a lot of kids with a tier level 3 where there's a massive gap in being able to access support. And those are the kids that are most at risk. So the big question is, if we can identify the number of kids in Perth and Kinross who have this level of need that's not been met, then we can begin to kind of do something about that.
Steve, I just wanted to say it was really actually quite good to hear you saying about teaching staff not being mental health experts, because I think sometimes we do forget that, and I keep reminding people that my degree is in music, and that's what I entered teaching qualified to do, but and I think like yourself and Eilidh, it's really, really important that we have easy resources for teaching staff to use. We similarly have a suite of resources on how to have a conversation about. It ranges from suicide prevention to self-harm to internet safety, how to have a CBT conversation, because that's the basis that we're going from, and having easy safety plans, and staff not being bombarded with so many different resources is really important, particularly when we were coming out of the pandemic. We've also really made sure that pupil voice is at the centre of what we're doing too. We've done a lot of work in our PSE courses in Renfrewshire, and last year we launched our mental health resource, It's the Mental Health Thing. We worked with Headstrong Scotland, and we took all the themes that were coming through our counselling service again and talked to young people across our schools about what they really needed to hear about and what were the issues that were impacting on them at their age and stage. And so we have a resource that's lift and go that can be used by anybody in a school, not just your key pupil support staff. Because although health and wellbeing is a responsibility of all staff in schools, it's not that easy because not everybody feels confident having that kind of conversation. So it's making sure that we are doing our best centrally to support all of our schools. In our 5th year resource of It's a Mental Health Thing, we actually have a young man talking about his experience of suicidal ideation when he was around about 3rd and 4th year. And he talks on camera about how he felt and just the difficulties he had just getting how he was feeling out there. And what we then get the young people to do is investigate a range of professionals who might be able to help him and help support him around getting better. So you meet a guidance teacher, you hear what they do in their job, you meet somebody from CAMS, you meet a GP, just a varied group of people, and then the young people decide, well, who'd be best to support Joe and how he's feeling right now. And then you come back and meet Joe at the end of the lesson or at the end of the series of lessons and find out what really worked for him. And I think that's so important because there is, as we've already said, there are supports out there, there are supports within our community, but how well do we access them and how well do our young people and our staff in schools, what do they know about them? So I think that's a really important point that both Eilidh and Steve have made.
I find that incredibly fascinating, Fee, because it's what you've developed, particularly for your senior phase in S5, and having the young person's voice central to that, because the PSE curriculum is crowded, and it's really can be difficult for staff to identify what are their priorities, and you have to use your local evidence as well to help to map out your PSE curriculum. So I'd love to talk to you more about that, because what we've done is we've most of our PSE teachers have been trained in assist, and as such are then able to deliver suicide talk, which we can talk about the name of it at another point, I'm sure, but it is called suicide talk. It is evidence-based. So we have kind of, with permission, used that as part of the curriculum in S5 to try, for those young people who've maybe not wanted to take part in Safe Talk, as a universal offer. We offer the suicide talk, but I think what you have done, where you've got the voices of young people central to it, sounds probably far more impactful than what we've done.
It's encouraging to hear as well, and maybe just to add to that a little bit is the kind of model that we're using in Perth and Kinross is that because my role is kind of unique in many ways. It's a suicide prevention coordinator role that is purely for children and young people. I don't have to attend to any of the adult services. We have another coordinator who does that here. But I can deliver bespoke training to individual schools or groups of staff, but then it's always followed up with access to me in terms of a consultation or any time. So I think the security that staff value in that has paid off. So it's not like you're accessing a training, you're expected to go off into the workplace and use it, and who's checking how you're using it and what impact it's making. So I'm quite attentive in that respect, whereby I've actually got a forum. I call it a suicide prevention MOT forum. I haven't come up with a proper name for it yet, but I kind of liken it to, let's kind of see where you're at. How are things doing? Who are all the staff that have access training? How are they using it? Are things working? Do we need to tweak it? So it's like you take your car to the garage and you get it checked out and you get it fixed and you crack on till next year. So that's the approach that I'm taking with it. So
That's all like really great examples. And I'm really glad to hear actually that evaluating, because it can be fine and well putting all this training and resources in place, but if we're not actually checking, is it actually working? How do we know really? So I'm really glad to hear about all of that. And actually I think as well, a lot of the teaching staff, across the whole school, not even just the education staff, the other staff in the school too, they probably all want to help. I think it's just, making sure they feel actually able and confident enough to do that.
Thank you for listening to part 1 of our Creating Hope podcast. Join us for part 2.